Welcome back, everyone. Ready for another deep dive. Today we're tackling a fascinating case. It's about a 9-year-old cat and a really rare brain condition.
Oh, this sounds intriguing.
It is. So this case report was published pretty recently, just this past September, in Frontiers in Veterinary Science. And get this, it's the first documented case of an intracranial epidermoid cyst being surgically treated ever in a cat.
Wow. First ever.
Yep. Ever.
So this wasn't the first time this condition was found in a cat, right? I seem to remember another case.
You're right. There was a previous case, but it was only diagnosed after the cat, unfortunately, had passed away.
Ah, I see.
So in this new case, they were actually able to try surgery, because of those amazing advancements in imaging.
Makes sense. So what was going on with this cat? What brought it to the vet in the first place?
Well, this cat had been having some neurological issues for a while, like 6 weeks or so. Yeah. The report mentions intermittent ataxia.
Ataxia, that's that lack of muscle coordination. Right?
Exactly. And also tetraparesis.
So weakness in all 4 limbs.
Right. Just imagine trying to walk with that going on.
Poor cat. That's a tough combination of symptoms to deal with. It must have been tricky for the vets to figure out what was going on at first.
Absolutely.
Yeah.
And to make matters worse, things took a downward spiral, and the cat had to be rushed to the hospital.
Oh, no.
Yeah. And when they got there, the cat was, well, stuporous.
Stuporous, so like barely conscious?
Exactly. And it couldn't stand up at all. Plus, it was showing nystagmus, that involuntary eye movement.
Those signs, especially the stupor and the nystagmus, point to a pretty serious problem in the brainstem.
The brainstem?
Yeah, the part of the brain that controls all the essential stuff like breathing, heart rate, all the basics.
So they knew they had to act quickly.
Yeah, definitely. Sounds like a critical situation.
And that's where the MRI came in. That was the key to figuring out what was causing all these problems, wasn't it?
Oh, absolutely. An MRI can be a lifesaver in these situations.
So what did the MRI show?
Well, they found a mass right there in the caudal aspect of the fourth ventricle.
The fourth ventricle.
Yeah, it's a space in the brain. It's important for cerebrospinal fluid circulation, that fluid that bathes the brain and spinal cord.
I see.
This mass was actually compressing the fourth ventricle, and that's what was causing what we call obstructive hydrocephalus.
Hydrocephalus, that's where the fluid builds up, right?
Exactly. Because it can't circulate properly when there's something blocking the flow. Now, if you look at figure 1 in the article, it shows you exactly where that mass was in the cat's brain.
Oh, wow. That's a really clear image.
Yeah, and the MRI gave them a ton of details about the mass, too. Like, on the T2 weighted and FLAIR images, it showed up really bright, what we call hyperintense. But on the T1 weighted images, it was the opposite, hypointense, meaning darker. And then when they injected a contrast agent, it showed enhancement just around the edges of the mass.
So all those findings, they helped pinpoint what the mass actually was.
Precisely. That specific combination of findings is really characteristic of epidermoid cysts. It helps rule out other types of brain lesions.
That's amazing how imaging can get so specific. Hold on, there's another interesting detail here. The MRI also picked up a second cystic lesion. This one was rostral to the cerebellum.
Yes. And the report suggested it might have been an arachnoid diverticulum.
Okay, and just to clarify for our listeners, arachnoid diverticula, what are those exactly?
They're like these little pouches filled with cerebrospinal fluid.
So another kind of cyst, in a way.
Sort of, yeah. But the thing is, in this case, we're not really sure how important this second lesion was.
So it might not have been contributing to the cat's problem.
Right. They couldn't say for sure.
So with the MRI results in hand, what did the vets decide to do?
Well, they knew they had to act fast. The cat was in really rough shape.
Yeah, the hydrocephalus was clearly a major issue.
Exactly. So they went for emergency surgery to try and remove that mass that was blocking the fourth ventricle.
Sounds risky.
It was. They did a craniectomy.
A craniectomy. So they actually had to open up the skull.
Yep. High-risk procedure for sure, but they were hoping to relieve the pressure from the fluid buildup and give the cat a fighting chance.
And during the surgery, they were able to confirm what the mass was.
Yes. They identified it as an epidermoid cyst, and they managed to remove it, the whole thing, including the cyst wall.
So that's good news, at least.
But here's the tragic part. The cat never started breathing on its own again after the surgery.
Oh, no. What a heartbreaking outcome.
It really is. The article does go into a lot of detail about the surgery itself and everything they tried to do to help the cat recover. Figure 3 actually shows what the mass looked like during the procedure.
I can see why they included those images. It's so valuable to have that level of detail documented for other vets to learn from.
I agree. This kind of thorough documentation is really important. It helps other veterinary professionals understand the challenges involved and maybe even refine surgical techniques for future cases.
Now, for our listeners who might not be familiar with this condition, can you explain what an epidermoid cyst is?
Sure, basically, they're these benign growths. They develop from skin cells that get misplaced during fetal development.
Misplaced skin cells in the brain.
It sounds strange, right? But for reasons we don't quite understand yet, these cells can end up in places they shouldn't be. And over time, they form this cyst. It's lined with the same kind of cells as your outer layer of skin, stratified squamous epithelium.
So like a little pocket of skin inside the brain.
In a way, yeah. And the cyst slowly fills up with keratin.
Keratin, that's the stuff our hair and nails are made of, right?
Exactly. That tough, fibrous protein. And as the keratin builds up in the cyst, it creates this, well, this waxy, pearl-like appearance. That's actually where the other name for these cysts comes from, cholesteatoma.
Cholesteatoma.
Yeah, it comes from the Greek words for cholesterol and tumor. Not that they're actually tumors, they're benign, but that's just another name you might hear used for them.
Okay, that makes sense. So this case report really highlights how rare intracranial epidermoid cysts are in cats, especially when you're talking about surgical treatment.
You got it. I mean, this is the first time we've ever seen a case where they successfully removed one of these cysts from a cat's brain. And we still don't know a whole lot about these cysts in cats. We do have some understanding from cases in humans and dogs. But even then, surgery can be really tricky.
I mean, even in humans and dogs, the outcome isn't always good.
Unfortunately, no. And with such limited data on cats, it's even harder to know the best way to treat them.
So what's the prognosis then for a cat with this condition? Is there any hope for a better outcome if it's caught earlier?
That's the crux of the matter. Unfortunately, the prognosis is still unclear. We need more research to understand how these cysts behave in cats, how they affect brain function over time, and if there are any surgical techniques that could lead to better results.
It sounds like there's still so much to learn about this condition.
Absolutely. This case report is definitely a step forward. It highlights both the challenges in diagnosing these cysts and the potential for surgical intervention.
Let's dig a little deeper into those challenges then. What can this case teach us about the complexities of veterinary neurology?
I think one of the big takeaways here is how important it is to recognize even those really subtle neurological signs in cats.
Subtle signs.
Yeah, cats are good at hiding when they don't feel well.
Oh yeah, for sure.
So owners might only see slight changes, like in how the cat walks, or maybe just acting a bit off.
And it'd be easy to just think, oh, well, my cat's getting older, or that's just how they are.
Exactly. So vets really need to be on high alert when a cat shows any neurological symptoms at all.
Especially if they're not going away or even getting worse.
Right. Catching it early can make all the difference, even if it's just running some basic tests to start ruling things out.
So what kind of research would help us understand the prognosis for cats with this condition better? What are the missing pieces of the puzzle?
Well, we need to learn more about how these cysts grow, how they affect the brain over time, and, if there are surgical techniques that could improve outcomes.
The report did mention that for humans, surgery is the standard treatment.
Yeah.
But even then, it depends on getting the entire cyst out. And there's always that chance it could come back.
And things get even more complicated when you're talking about veterinary medicine.
How so?
Well, we have far fewer cases to study, and surgical approaches are still being developed and refined.
Right. This report mentioned that the vets used an occipital approach to remove the cyst. But sadly, the cat never regained spontaneous breathing.
It just shows how delicate brainstem surgery really is.
Yeah.
Anytime you're operating in that area, there are big risks because, it's controlling those vital functions like breathing. It's a tough reality we face when treating conditions that affect the brainstem.
The article also mentioned a different approach, a lateral approach.
Oh, right, yeah.
They said it's been used for meningiomas in cats, in the cerebellar fossa specifically, and apparently without any complications. So I'm wondering, could that approach have been better in this case?
That's a good question. The lateral approach might be less traumatic to the brainstem, but it's hard to say for sure if it would have made a difference for this particular cat.
That's true. I mean, the cat was already in respiratory distress before they even started the surgery.
Yeah.
That suggests the brainstem was already pretty compromised. So maybe the outcome wouldn't have been much different no matter which approach they used.
Yeah, that's a valid point. It just goes to show that you have to carefully weigh the risks and benefits in each individual case. There's no one-size-fits-all answer.
This case really highlights how far we've come in veterinary neurology, especially with MRI. I mean, without the MRI, the vets never would have known what was causing the cat's problems.
It's amazing, isn't it? Those imaging techniques let us see inside the brain. We can diagnose conditions that we never could have before. It's totally changed the game for neurology.
It really has. But even with these incredible advancements, there's still so much we don't understand about the brain
I know, it's true.
and how to treat so many neurological conditions.
Especially in animals. Absolutely. This case is a good reminder that we still have a lot to learn and that we need to keep pushing the boundaries of veterinary neurology.
So this deep dive has definitely left us with more questions than answers,
True.
but it's also given us a lot to think about how we diagnose and treat these difficult neurological cases in animals.
It's these kinds of cases, the really challenging ones, that push us to keep learning, and ultimately that leads to better care for our patients.
Now let's take a step back and consider some of the limitations of this specific case report and what future research might uncover. It's important to remember this is just one case, right?
Right.
So we can't really jump to any big conclusions about whether surgery works for this or what the overall prognosis is for cats with this condition.
You got it. We got to be careful not to overgeneralize from just one case. We need way more research, more cases to look at, to give vets more solid evidence for making decisions.
The report also mentioned using a low-field MRI was a limitation, and not having all the details about how the cat was doing before it got to the hospital.
Those are definitely things to keep in mind. A higher field MRI, that could have given them even better images,
Yeah,
of the cyst and everything around it.
right.
Maybe there were some subtle details they missed that could have helped with the surgery.
And knowing more about the cat's symptoms before, like right from the start, from that ataxia and tetraparesis, that would give us a better picture of how this condition usually develops in cats.
Exactly. It's like, trying to solve a puzzle, but some of the pieces are missing. The more info we have, the better.
Okay, so for vets and cat owners out there, what are the big takeaways? What should they be thinking about?
Well, first off, this case really shows how important it is to do a thorough neuro exam for any cat showing signs of ataxia, tetraparesis, any neurological weirdness, really.
Early detection is key.
Absolutely. The earlier you catch it, the more options you might have, even if those options are still limited right now, given what we know.
And MRI. That's crucial for diagnosing these tricky neurological conditions.
Absolutely. An MRI can tell you so much. Where the lesion is, its size, what it looks like.
Right.
And that all helps guide treatment decisions and potentially lets you intervene earlier.
And for cat owners, I guess the message is, even those little changes in how your cat moves or acts, those could be a sign of a bigger problem.
Definitely. If you notice anything off about your cat's coordination or how they're walking, always best to get them checked out by your vet sooner rather than later.
Well, even though this case had a sad ending, it's definitely a step forward in understanding this rare and difficult condition.
I agree. It shows how dedicated veterinary researchers and clinicians are. They're working hard to figure out the brain and how to help our feline friends.
This deep dive has given us all a lot to think about.
For sure.
About the science behind this condition, the importance of catching it early, and continuing to do research in veterinary neurology.
It's through these deep dives, these explorations of tough cases, that we keep learning and growing in veterinary medicine.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.